We work in our center with a strategy of transplantation in pediatric patients that is CD45 RA positive depleted. RA positive depleted. So in these patients, we saw a very high rate of herpes 6 virus encephalitis, about 64%, when normal rates are below 10%, especially in patients that receive cord blood transplantation. And so we tried to figure out what was going on with this. So we saw that we have a graft very rich on CD4, and a graft with very low natural killer cells. So what we tried to study was that these CD4 cells, they transmitted the virus from donor to patient. And our decision was to start on very early transplantation on day 7, infusion of natural killer cells on a ratio that was 2:1 from CD4 cells to natural killers. The median dose that we infused was a million cells to 2 million cells per kilogram of natural killer. And we saw that even if we had reactivations, 2 reactivations, we hadn't seen any encephalitis in our patients. So we found a way to boost the innate immunity, and to also a way to avoid this complication. We saw no GVHD related to the MK infusion, and we only had 1 infusional reaction, and it was a very safe strategy. And we performed leukapheresis on day 6, and we performed 2 procedures of cellular selection. We first performed a CD3 depletion, and then on that fraction we perform a CD66 enrichment, and this is our natural killer product. So this is very easy, because especially because donors are familiar donors, and it's very easy to perform a leukapheresis if we can avoid this complication.